Good evening, everyone. I'm Leon Bibb. Tonight, for the next 30 minutes, we're dedicating this broadcast to a special topic, one that affects so many Americans, and that topic is loneliness. Now, you will notice at the bottom of the television screen a QR code. You simply point your camera to that QR code and it will take you directly to a link that will provide resources to you on the subject of dealing with loneliness. Now, Dr. Amy Acton, who led our state of Ohio through the early stages of COVID, shares stories of people and of organizations right here in Northeast Ohio helping people heal and hope.
I am Dr. Amy Acton, perhaps best known for my work during the COVID pandemic. People at home, you are moving mountains. You are saving lives.
She has become one of the most important voices of information in the battle against the coronavirus, and her calm, steady approach is winning her national praise and respect. Dr. Amy Acton is the director of the Ohio Department of Health, and she joined us from Columbus. Dr. Acton, thanks for being with us. We appreciate it.
I am absolutely certain you will look back and know that you helped save each other in this state. I would say I am a very ordinary person who found myself in an extraordinary moment in the crosshairs of history, and it was the honor of a lifetime to hold space. While we did go through a lot, and certainly COVID unmasked a lot that we were dealing with even before, at the same time, we are sitting in a moment where we can create the kinds of communities and the kind of Ohio that we want to live in and be in, and we can create the kind of relationships with one another again. There's no one who has gone unscathed, no one who still doesn't feel a bit untethered in the world. That's why it's so vital that we are intentional about how we recreate the fabric of our communities. And what I love now is I see a pathway forward for healing and hope. I've been a physician in preventive medicine and public health for over 35 years. 2/3 what affects our health, how long we live, how well we thrive, has to come from things that we can only solve collectively. In 2023, the Surgeon General came out with an advisory of an epidemic of loneliness.
Being socially disconnected, which can range from feeling alone to being isolated, is bad both for individual and societal health.
In fact, looking at data going as far back as 2 decades, we found that 1 in 2 Americans is suffering from a sense of loneliness and isolation, and that can have profound impact on your health.
Research shows that loneliness and isolation are associated with a greater risk of heart disease, dementia, stroke, depression, anxiety, and premature death.
So as a doctor, the first place I always go is obviously to the science. We couldn't have started our journey at a better place than at Case Western Reserve University with Dr. Eileen Anderson, truly an expert on how the social determinants of health affect our well-being.
Dr. Acton, amazing to meet you. So the Surgeon General and others have described loneliness in 2 ways. One is kind of the objective sense of loneliness, that you don't have people in your life. But there's also that very subjective sense of loneliness that anyone can face.
I was enthralled talking to Dr. Anderson, obviously a lifetime of studying how our relationships and our world around us affect our health. Do we see it in certain age groups more than others?
It is incredibly widespread. And what we know is that how we feel and what we do impacts our biology as well.
This report is chock full of research showing the effects of isolation and disconnection, literally causing disease and death, issues with depression and anxiety. It also affects our productivity. How does something emotional or psychological get under our skin?
If we experience something as uplifting or hopeful or enjoyable, we have different kind of neurotransmitters released that then help our health. But if we're having a hard time, then we start to have stress hormones like cortisol that take a toll on our body.
We talked about beauty and the recent science on awe and wonder that can profoundly change our neurochemistry and how we feel. One of the blessings of the pandemic is we rediscovered the natural world around us.
Oh, that is so true. And some amazing studies have been launched looking at like brain changes after time in nature, and it's so good for us.
We happened to be walking along the beautiful campus when we turned a corner and stumbled into a fawn and her doe.
Aww, see the happy moments.
The awe and the wonder at seeing nature and beauty right here in the middle of city life. It works, it changes us. I used to think about, in the very beginning, Ohioans trying to pull one another up on a life raft. We all had wherever we sat to help. How do we let folks back in?
People have to have enough energy to get themselves through a day to then reach out. But it's a paradox in a way, because when you help someone, you actually start to feel better too.
So we can't give up on one another.
I think absolutely we can.
The time is now to double down.
Yes, yes.
Coming up, health. We're going inside a Metro Health initiative aimed at addressing the underlying causes of illness.
Taking medicine for our health is important, but so much more affects our health than that. We call that the social determinants. And now doctors and clinicians are screening patients for things like housing and food, and importantly, relationships and the quality of relationships. So this is a big way we can begin to make a difference as a healthcare system. It was such a pleasure to meet the folks from the Institute for Hope at Metro Health. And HOPE is an acronym for Health, Opportunity, Partnerships, and Empowerment.
The Institute for Hope was founded at Metro Health in 2019, and it is the health system's commitment to identify and act on the social drivers of health.
What the Surgeon General explained was that many of the diseases of despair we see, whether it be gun violence, we see opiates and addiction, depression and anxiety, all of these things have an underlying cause, a root cause. And that is our lack of connection.
We have a 22-item screener that's embedded right in the electronic health record. Our screening results have shown that 49% of patients who screen are at high risk for social isolation.
We had the opportunity to come alongside the Calls for Hope program, which engages volunteers in making a difference, but also does a tremendous good for folks who are in need of connection.
It is a wonderful way to bring volunteers and our patients together and just to learn about things that they have in common, talk about hobbies, and ultimately we want to be able to provide the patients a way to reconnect.
One of the most poignant moments for me in this conversation was when Marcy, the volunteer, talked about the benefits, how having a relationship has changed her life.
In my mind, I'm like, a good way to give back, right? In reality, as you had mentioned, the transformational process that impacted me it was powerful. I connected with this one particular patient. He and I have just become fast friends. He is my buddy, and it has helped me in a way to think about perspective.
He's kind enough to let us do a call for hope with him.
Please hold for a moment while we connect you and enjoy your friendly call. Hello?
Hey, Claude. How you doing?
Hi. How you doing, Marcy?
I'm good, Claude. You're on the line with Dr. Amy Acton. I'll let her speak now.
Hi, Claude. Thank you for letting us call you today. How are you?
Yeah, I'm okay. I'm just here in this dry heat and stuff.
The volunteers are able to connect back to the larger program. They learn things about people's lives, what they're going through. You'll hear in this call with Claude that he talks about other things going on in his life that then the program can follow up with and reach back out on.
It's good that they have programs like that, to help us. And I sure thank Metro kindly.
Claude, it's so nice to meet you. It's so great to hear your voice. Thank you.
Thank you. Have a blessed day.
You have a blessed day too. So a wonderful part of this is that the solution is hidden in plain sight. It's in our individual control. And what's wonderful about the Calls for Hope program is it shows how little actions that we can take individually as volunteers can have a profound effect on people's lives.
And this is so easy because people don't have to leave their home, right? I mean, and that's like the first step. So you give somebody a little bit of confidence, a little more socialization, they can make even more connections.
So the Surgeon General's report really calls out the role of technology on our lives and on our well-being.
It's really extraordinary what technology has enabled. But we also have to recognize that there are different types of technology, and how we use technology makes a difference in the quality of our interactions with one another.
We recognize that lack of access to the internet can be a barrier to connecting. And so we have a number of initiatives in place with partners throughout the community. We have connected about 1,200 households within the last year or so.
Metro Health at the most basic level, trying to get broadband and just basic access to technology into homes, into neighborhoods, right here in our community.
Still ahead, healing. We will talk with Judge William Dawson, who is using social media and his passion for yoga as a means to restore community.
So being lonely is something, being isolated is something we feel across the lifespan. We certainly think about the elderly as we're aging longer, but our young folks as well. Social media and technology creating both the opportunity for connection, but also a tremendous amount of feeling isolated and alone. I had the honor of going to East Cleveland and meeting with Judge William Dawson. I'm not a big social media person, as folks know, but being able to dive deep and go down the rabbit hole of Judge Dawson was eye-opening.
One tool of transformation that you always have to use is your ability to control your emotions so that you don't put yourself in a bad position with the law.
I grew up with a single mom in a city that's primarily African American with high poverty, which means I got in a lot of trouble. I did some things I wasn't supposed to do, but because my mom instilled values in me, I always knew where the right road was. I wanted to bring all of my experience back to the city, so I actually make the choice to come back to East Cleveland, to run for judge in this city, and to try to make a difference.
Like everyone we interviewed, Judge Dawson brought his own life and his own experiences to his work and to how he is emerging and healing from the pandemic.
I said, you know what, I'm gonna be a different type of judge. I'm gonna be compassionate, I'm gonna be understanding, and I'm gonna have a belief in second chances. I don't want you to come back for any trouble. I don't want you to come back to be put in jail. I want to figure out how I can start the new year off helping you with whatever it is you need. Once social media began to become the thing to do, I said I have to put my message out on social media. If no one listens, just so they'll hear it, like, okay, this judge is talking about compassion, or this judge is talking about don't run from the police, or these are the dangers of having bad relationships.
Many times our behaviors can be adaptations to sort of self-medicate, to try to heal ourselves. And I think Judge Dawson understands that deeply.
Namaste. It's Judge Dawson coming to you from the Yoga Lab. And today I want to talk to you about preserving your peace. Preserving your peace.
This comes from his deep, deep study of yoga, his deep belief that in Namaste and that the God in me greets the God in you, the most basic element of human dignity.
Yoga will help you no matter where you are. The ability to tap into your breath and calm down, it's invaluable. So this is my little personal area, and this is where I come to decompress and plan before I go out on the bench. And warrior one, arms up. 3, 2, 1, arms down. I had a very unique opportunity after we started opening things back up, from the pandemic, to work with some of the seniors in our community. And it's so interesting that the first time I went there, I noticed how they were so excited about connecting again. Welcome to the Yoga Lab, your first time at the studio.
I had the privilege of being in his yoga studio. They're coming together in a shared space to check in on one another, to be together, to have fun, to feel joy, and to heal.
And then maybe it'll be way up here. This will be our trees. But not today, not today. All right? If you've ever been to my class, every single class I end with, I say 1, 2, 3, we're gonna say, I love me, and we do it. 1, 2, 3, I love me. So we reestablish the fact that we love ourselves so that we can then in turn love other people.
It's a pet peeve of mine that people see kindness as weakness, and he was very quick as a yogi to remind me that kindness is strong.
I'll give you love and compassion, and then I'll hit a handstand with one arm or something to let you know that there's strength behind that.
There's strength.
And then in the courtroom, it's the same thing.
He's getting rid of the word probation. He's calling it a school of transformation. He understands that people have traveled a life, and he actually in his courtroom, while being very much about the justice and the consequences and the taking responsibility, also helps folks find a way back to themselves, to their dignity, and to ways of connecting that are much more healthy.
I actually have some of the probationers come to the yoga studio to do yoga. Of course, they don't have to pay, it's nothing like that, but they're gonna get the experience of breath work, meditation, mindfulness.
You can't help being around Judge Dawson to not feel the energy. It's infectious. Judge Dawson's a role model, and that led us to really think about this next generation of healing and hope. Many worry about youth and all they've endured during the pandemic. I see Generation C, Generation COVID, not just as chaos and a virus. I see a generation that is willing to have hard conversations, that is willing to collaborate, that understands the value of community and connection.
And finally tonight, hope. Looking at how the next generation is showing us how easy it is to spread kindness.
We are hardwired from birth to need one another, and we are also wired to build community. And when I think about this generation and all that they will bring to bear in healing and hope, I had the privilege of meeting Augusta Halley, a wonderful young woman with a bright career ahead, and we got to meet her and her horse at the Geauga County Fair. It is the oldest fair in Ohio, 201 years old this year. And over Labor Day, it was a scene of so much energy and joy. 4-H, of which Augusta is a part, is an amazing program where kids learn responsibility. They learn how to engage in the world to solve problems on their own, and we know science is showing that young people need to be able out there solving problems and making a difference. So tell me, you've been a part of 4-H. How did you get involved?
I actually moved from California to Ohio in 9th grade, and then it was COVID, and it was a very isolating time. So I was looking for outlets where I could kind of feel more connected and get more involved in the community, and 4-H was a great opportunity. This is Hillbilly. We call her Billy.
What are you competing in?
We're competing in a little bit of everything. So we do the jumping classes and then the Western and English and everything.
It was a beautiful day and a beautiful setting in which to get to know Augusta better. She was able to share a lot of what she observes in her peers and how people can so easily become isolated and alone. And she was actually selected, a real honor, to be on the governor's school safety task force.
Just the impact of school shootings and violence, I really wanted to make a change and an impact on the community that could do some good and help us be more aware.
And in doing so, she created a project alongside Kindland, a wonderful initiative here in the Cleveland region that hopes to spread around the country about how acts of kindness can be done intentionally to change community.
I had an idea called the 21 Acts of Kindness to honor the 21 lives lost in Uvalde, because that was when the project started, right after that shooting. It's just a flyer, and it has some fun acts of kindness, so people would scan the QR code and then they log their acts of kindness on the app. The impact has been phenomenal. It's reached from West Coast to East Coast, so it's been really amazing to see the impact in reducing school violence and even dropout rates and bullying. It's really cool.
Kindness is an age-old enduring principle by choosing to be kind, to be fiercely kind and just in a world where sometimes doesn't feel like it is fair or just. Profoundly changes you, and it changes the world around us.
It doesn't matter how big or small your act of kindness is, and just reaching out to someone and smiling at them, I don't think people realize the power that a smile has, or a wave, or a hello. Just interacting with someone can be super meaningful.
These aren't small acts. These are the acts that build the world we want to live in, and quite literally, it makes the difference of the kind of world that we're going to leave for the next generation. I'll tell you, a lot of us are looking for like some hope and healing.
Yeah.
As we all emerge, just being around you, being here, it gives me a great deal of hope. We need to overcome the stigma associated with loneliness and isolation, because all of us will experience this at one time or another. 1 and 2 are experiencing it right now. And if you are really in crisis, please don't hesitate to reach out. You can call the crisis hotline at 988 to ask for help. I hope for those listening that you can remember that feeling at the beginning of the pandemic, when we all came together, not because we wanted to, because everything changed on a dime. But there we were, and we found ourselves not alone, but actually together. I think this is a journey we're all on, and I encourage you, we have lots to share and resources to share where you can learn more about kindness and connection, learn more about the Surgeon General's report for health and well-being, and learn more about ways you can begin to make a difference for yourself and for others. Make no mistake, we cannot wait for the world around us to change. So I encourage you to join us on this journey of help, of healing, and of hope.
We have a list of all the resources for anyone battling loneliness on our website, wkyc.com. You can also watch this entire special on our streaming platform. Just download the WKYC Plus app. Thank you for watching, and enjoy your evening.